Hello guys, welcome to my channel. Thank you for taking your time to come watch this video. But today we're going to talk about some jobs in the nursing field and some of your scheduling and also the flexibility of the job and the certification you need to get to that job. Thank you and please stay with me. So the first job we have here is the Certified Nursing Assistant, also known as the CNA. I'm sure some of you have heard of it before. And the CNA, you need about 4 to 6 weeks of school, depending on where you go. So some is being offered at community colleges. Sometimes they also offer them at some private agencies, so people own them. And also you could go to some hospitals also offer it. And in some nursing schools, some registered nursing schools, after the first semester of nursing, you can qualify to be a CNA. You need to take a board exam after to get in. It's a competency exam before you're able to practice. Some jobs will let you practice without the competency exam, but ideally, most of the state require a competency exam and a license. You do a skills exam, then you also do a written exam before you can get in. In addition to that, some of the job requirements of the CNAs, they help with activities of daily living. So that is, they help with cleaning, they help with bathing the patients. Some of them check vital signs depending on the facility. Some even work as home health. So they go to the person's home to do everything. Some drive to their homes, they drive to other homes to do all of this. They also provide emotional support. In addition to emotional support, they can also help, even some of them do groceries for the patients. Like if it's a one-on-one, they can go do groceries for you. So yeah, these are some of the things you need to do. In terms of hours, in terms of scheduling, with the CNAs, some of them work 8-hour shifts. It's around the clock, so it's a 24-hour job. You could work nights, you could work days, you could work in betweens. Some work 8-hour shifts, so like 7 to 3, 3 to 11, 11 to 7:30. Some of them work 12-hour shifts, and some of them even take a step and do overtime and work probably 16-hour shifts. It depends on where you work, in the hospitals, in the rehab setting, in the private agencies. Some can also do the regular 8 to 5s, Monday to Fridays. Some people have kids, so that's how they work. Next on the list, we have the LPN or the LVN. California says LVN, Texas also uses LVN, but the other states use LPN, licensed practitioner nurse, or licensed vocational nurse. So these nurses usually go to school for about a year or two. You could do it at a community college, you could do it at a private agency, a private university, and it's usually after that you take an NCLEX LPN. That is the licensure exam. So you have to take that exam, then you apply for your license. It's not a skills exam, it's a written exam, but it's more incorporated. In terms of the job requirements, they also check vital signs of patients. They also document. Some of them administer medications. Some of them also change wounds. Some of them go to people's homes to do all of these activities. Most of them work in the rehab setting. They also work in the nursing homes. Some hospitals hire LPNs. Some don't. I've personally not worked in a hospital that hires LPNs, but I've heard of hospitals that hire LPNs, especially in the ED. So they decrease the workload on the RNs, the registered nurses. LPNs also take orders from doctors to execute. Yeah. So it's the LPN. In terms of job hours, it's the same as CNAs. Most of the healthcare jobs have around the clock scheduling, depending on private agency, hospitals, or rehab. So you can work 8 hours, you can work 12 hours, you can work 16 hours. People don't usually work 16 hours. It's usually for overtime. You can also work 8 to 5s. So some people work in doctor's office, some of them work in rehab settings, some of them do overnight shifts, some of them do evening shifts, which is like 3 to 11 p.m. So depending on where you work, if you're trying to consider a career in LPN, you should just Google the closest LPN school next to you. You have to think about the cost too, the tuition, if you have to take loans. Salary will also depend on where you work or where you're trying to practice at. And the last main one I want to talk about is the registered nursing. So registered nursing, we have usually two main types in terms of education wise. So we have the ADN, that is the associate degree in nursing, and then we have the BSN RN, that's the bachelor's degree in nursing. We also have like MSN that people do it in the master's level, but they become RNs. So there's ways you can get it, but at the end, you all take the RN exam, which is the NCLEX RN. So for the LPN, it was NCLEX PN. But for the RN, it's the NCLEX RN. It's a licensure exam. It's pretty tough. You sit and study for it. I've taken it before, that's why I'm probably a little bit biased. And in terms of schooling, with the ADN, you have to go to a community college. Community college RNs are usually 2-year programs, but you have to take the prerequisites before you get in. I'm gonna drop another video that talks about the prerequisites in nursing school. It's school dependent though, but I'm gonna talk about what I took and how I was able to get through this journey. So you have to, with community college, you have to take the prerequisite. We could take a year or two before you also go to the RN school, which is the RN community college school. Usually you take exams to get in. You can take the ATITs exam, or you can take the HESI. It's school dependent. Some schools also make you take the Kaplan exam. I had taken Kaplan before. I had taken the T's before. I've seen some HESI questions. It's usually like math, English, science, and sometimes reading. So the English has reading and probably English language. With the BSN, it's usually like the 4-year colleges. So the universities, they offer that. People sometimes get into the nursing program straight, or they get into it after their first year of college. So with the BSN RN, when you're done, you also take the NCLEX. A lot of things I've seen is people that do the ADN, as soon as they're done, they do the BSN online. In addition to that, in terms of job, RNs work in the hospital, they work in the nursing home, they work in private agencies. So we have acute care settings and long-term settings. Some of them do hospice. The hours are also around the clock. You can do 10 hours for like ORs. You can do 12 hours. Some do 8 to 5s. My hospital currently does 8-hour shifts and I don't like it. I like 12-hour shift, but hopefully we switch soon. So with some RN jobs, we can have pediatric nursing. They usually take care of kids. As the name suggests, pediatric. We have critical care nurses. Usually they work in the ICUs, so the ICU nurses. We have emergency nurses. We have psychiatric nurses. They take care of mentally unstable people, and also we also have stroke nurses. So we have different kinds of nurses. We have wound care nurses. They change wounds. They specialize only on that. In my next videos or subsequent videos, I'm going to talk about advanced practice registered nursing. So these are like the nurse practitioners, the CRNAs. I'm going to talk about the type of schooling and how you get there. And so if you like these content and you want to get more of these, please don't forget to hit like and subscribe. So anytime I post, you can come in for the good stuff. Okay? Thank you guys.